Fluoxetine. Unfortunately, depression hits children as well. It is recommended that the child's dose between ages 7 and 17 is 10 milligrams orally per day, maximum 20 milligrams per day. Here, we see a young child, Max, who was started off on 10 milligrams per day.
I was having really dark thoughts about suicide. My mother had gotten worried about this and took me to the hospital. At the hospital, the doctors prescribed me Prozac. 10 milligrams. It helped for a few years. Then they needed to up the dosage to 20. I'm feeling fine now.
No more dark thoughts, suicidal thoughts?
No.
Have your grades improved and your friendships at school and relationship with your parents since taking the Prozac?
They've improved.
From what your mother said, they've had to watch you very carefully because of the black box warnings that it can actually make things worse. Did you have any experiences with it making you feel worse?
No, I have not.
Overall, what would you say Prozac has done with your life?
Improved it.
Oftentimes, many people will take natural means to try to shake their depression and chase away the gloominess. Unfortunately, just because some methods are natural doesn't mean that they are harmless. They can have serious interactions with fluoxetine, as we see here. So now we have another citizen here that has had a slightly different experience with Prozac. Duncan, which his last name is being withheld for patient privacy, has always been more about natural means and has always been, as he told us, against traditional Western medicine. Duncan, what is your experience with Prozac?
Well, I didn't have a very good experience with Prozac, to be honest. I'm all about natural methods. You see, I was trying St. John's wort, Sammy, valerian root, hops and lavender, and, all the essential oils, and it wasn't helping. And so, doctor got me on about 20 milligrams of Prozac, and, well, I just didn't tell him about any of the other supplements I was taking and everything else, because they're all natural, it's not medicine. Well, next thing I know, I'm waking up in the hospital. I feel terrible, I'm throwing up, I'm dizzy, I'm nauseous, I'm so confused, and they tell me, my blood pressure's, 220 over 110.
What did they say that it was wrong with you?
Serotonin syndrome or something? Anyway, I don't know. I think I'll be telling them all the things I'm taking, including my supplements, next time, so I don't have to go through this again.
I'm so sorry to hear that you had such a bad experience. That's really frightening.
Yeah.
Adult dosage, PO, 20 milligrams a day in the AM. After 4 weeks, if no clinical improvement is noted, dose may be increased to 20 milligrams twice a day in AM and PM, maximum 80 milligrams per day.
Well, I think COVID has affected a lot of us. For me personally, it's the isolation that has really gotten to me. Not seeing my friends, not going to work, school's online. It's really depressed me, I'd say.
So what have you done in regards to the depression? Have you done any kind of exercise regimen? Have you changed anything? What has helped you the most?
Well, I was talking to my friend on the phone and I was expressing my signs of depression and he told me to go see my doctor. And so I went and I saw my doctor, Dr. Feelgood, And at first, he started me off on a 20 milligram dose a day. And at first, it wasn't really doing anything. So he gradually upped my dosage, eventually getting me to the max over a couple weeks, months. And now I'm taking 80 milligrams a day, 2 pills of 20 milligrams in the AM and 2 in the PM. And I have to say it's working. I'm feeling much better.
Great. And have you experienced any kind of side effects from the medication?
Well, when I first started, I had a lot of stomach issues and I lost some weight, but I've got that under control now. And the only other side effect I have is dry mouth, but it's a small price to pay for happiness.
What would you recommend to anybody else who might also be struggling with the changes in day-to-day life due to COVID or any other stressful situation?
Well, I wouldn't go right out and say I would recommend Prozac because every patient is different and everyone has their own experience with it. So I would say go see a doctor, see a healthcare professional, and get the help you need.